Coming from work empty-handed has become the norm for Yohanna Yaqub. The daily laborer makes little money, and food prices have soared since the discovery of the coronavirus here.
We don't have health insurance. If someone in the family gets really sick, we try to get them treatment, but if we don't have the money, we wait for the illness to pass. We rarely eat nutritious food. Now with this new disease, I've not even thought of stocking up because I barely have money for one day.
Fruit prices have trebled since the virus was found in Sudan. Several government directives have been issued aimed at containing the spread, including banning large crowds. But over the past few weeks, fuel and bread shortages have resulted in long queues. And that's not the only challenge. The guy behind me is selling masks at 50 pounds a piece. That's the equivalent of $1 using the official exchange rate. An entire box is worth $50. Health workers here say prior to the detection of the coronavirus, a box of masks was worth just $5. Masks, as well as hand sanitizers, quickly disappeared from shelves in shops and pharmacies and are now sold in the streets. With half of Sudan's 40 million officially living in poverty, they're a luxury many can't afford.
We're talking about thousands of infections, potential infections, I would say. But people reacting in the streets, I would say, it's become more of a careless because I cannot afford that. I would rather buy food so that I can live.
The virus will affect everyone, so we should be working together to fight it and try to protect the country to make sure the virus doesn't spread.
The government has also prepared isolation centers, like this one near the border with Egypt, a country where more than 100 cases have been reported. But Sudan has suffered 20 years of international sanctions and has less than 7 doctors for every 1,000 people. Basic equipment's also in short supply.
The equipment for testing, the places, the doctors and the kits are very limited in number, but we have to centralize it to make sure that the testing for this new virus is done safely and correctly. There was a test that was negative and then a second test that showed a positive. This is common in many diseases and complicates matters, so we have to do repeated tests, and now we're working to get the support for that.
Yohanna says he has little hope of providing for his family with the nutrition needed to help protect them. But he hopes that if the coronavirus does reach his family, they get the medical support needed. Hiba, Al Jazeera, Khartoum.